Everybody, it is Matt and Dyan. Welcome back to OK Aussie. It is Friday, 1st of August. Current time is 5:02, and I think Dyan is starting to go a bit off the line, is my concern at the moment. Quite possibly we might have something going on, so we're just going to help her get a few things organised ready very quickly. I'm just going to move both of those out of the way so that you don't have any accidents with that. I'm going to get the pulse oximeter on right now, just so that we can get some stats up. Now, I have just applied some on Downsitron, 4 milligrams, sublingually. Dyan's just going right now into some syncope. She had some pre-syncope before. Hello, gorgeous. You want your socks off, do you? No worries. Let's just get the pulse oximeter up and see where you're sitting at. Hello, gorgeous. Right here. Just let me get some things done. So it is 19 degrees outside in sunny Perth. Dyan's oxygen sats are 96. Heart rate is 73. Left eye is fully closed with blepharism. Right eye is at half mast. Feeling no focalized dystonia in either left or right foot. Yes, baby. Just getting the oxygen out in case we need that. Let's bring up your stats and get the alarms on so we can actually hear what's going on. Downloading data. You need to know lots of downloading of data going on. Right. Same both sides. So we've got a 38.0. So Dyan's obviously in febrile. If we can get her conscious, I'll get some Panadol Osteo into her. Alarms are on and active. Interesting. Left comfort roll, 504. Hey, sweetie. You okay? I actually need you on your back, darling, just so that I can take your blood pressure. Yes, sweet babe. Would you want me to take that jumper off you?
No.
No? Just that you're running hot.
I'm cold.
You're cold. It's 22.9 degrees inside. She's running 38.0. And it's 19 degrees outside in sunny Perth, Western Australia. Indications of a malar facial rash, both sides equally bilaterally with a butterfly rash. More of an indication of an autoimmune compromise, just taking blood pressure. Dyan was just indicating some pain immediately before going into pre-syncope and syncope. She's now offline at the moment. I was about to give her some tramadol drops just to help with the pain.
Ow.
So you're going to have a bit of a slight pressure of your right arm just as the blood pressure cuff takes its reading. Oxygen stats are 97, heart rate is 64, which is matched exactly on the blood pressure at 64. So 100 over 65 is blood pressure. Dyan's normally around the 85 over 60. She's normally bradycardic.
My vehicle. My vehicle.
What's wrong, sweetie?
Vehicle.
Your feet are cold. Well, your socks just came off, kiddo.
On.
You want them on now? on and off. You're feeling cold, you're shivering, and yet you're running a fever. That's interesting. You need to have a bath. Yeah, I get that. Don't know if that's going to be happening all that soon though. It's currently 5:06. Dyan's showing signs of oromandibular dystonia and blepharism, all part of the segmented cranial dystonia. Dyan, I need to give you some medication. Are you able to swallow for me?
What?
I need to give you some clonazepam immediately. I'm going to just take you up a little bit, just to make swallowing all that much easier. This is the in-between phase where it's not that easy to do anything, is it? Alright, if I place this on your lip, it's just going in. Good girl. On your tongue. Drink is here. We're going to do 2 swallows. Close your lip down. Create suction. Really struggling to get some, aren't you? It's okay. You're doing really well this swallowing. Good girl. Good job. Want some more sip? Yeah, that's clear. That's okay. It's okay. So you can see the fibrillation coming across the left cheek. You can see how the eyebrows have just formed up. There's a slight depression in neuropathy on the right hand. We're probably going to go into seizures very shortly, which is where the right arm tilting is occurring. It's 5:08. We've got a cross-body flexation. We've got dystonia in the left. It's likely to do a left roll. As you can see, the struggle at the moment. It's all right, Papa. I've got you right here. It's okay. All right. Oxygen stats at 96, heart rate is 70, aspiration difficulty. Good girl. It's okay. It's okay. It's okay. 5:09, so we've had a mild tonic-clonic seizure during that. Roll and recover. Roll and recover. Yeah, I get you. Oxygen stats 96, heart rate 77. Secondary seizure, 5:09. It's alright, kiddo. It's alright. Just supporting the right arm. Right shoulder has glenohumeral related issues with major anterior subluxation previously and damage to that whole glenohumeral joint, Hillman sac injury, so it is very vulnerable during tonic-clonic seizures like that. 5:10. So 2 short duration tonic-clonic seizures in that mode. Oxygen stats at 97, heart rate at 74. We've got syncope in between. Just getting oxygen reading in case needed. Oxygen stats are good at 96. Heart rate is 72 and dropping. It's okay. You're doing really, really, really well, kitten. Just preparing midazolam as an emergency medication use. Doing really well. It's 5:12 p.m. Oxygen starts at 97, heart rate 67. Right here, sweetie. Get you through this. You're doing really well. Hiya. You can see me, can't you? Hello. It's okay. I'm right here. Oxygen starts at 96, heart rate 63. It's okay. You've got nasal flare, so you're trying to get some oxygen in. Dyan's got a deviated septum, so that actually reduces airflow by about 70% on one side of the nostrils. We're getting left oromandibular and jaw thrusting activities with the tongue poke. So the combination, neurological combination of having dystonia whilst also having tonic-clonic seizures. Hand posturing is showing focalized dystonia in left hand, right hand is flexed and fine. You can see here these little motions that are going on. So this is all involuntary muscle contractions that are occurring with the dystonia. So they'll cause either contracture or fibrillations. They're also originating from a basal ganglia miscommunication to various parts of the body. She can be doing, meanwhile, inaudible seizures, so that's what we're acutely just aware of at the moment. Oxygen stats are 96, oxygen heart rate 71, so good stability there. Twitching going through here, so tonic-clonic seizure 513, figure 4 position posture, left roll attempt. You can see the feet, see the body. So this is her third tonic-clonic seizure. In this subset, we've got very forced flexation of the muscles in the feet, hand position, rigidity coming out of that. Both eyes are left postural glare fixed. Jaw is locked down with the mandibular and bruxism, so that grinding and rigidity around the jaw as those muscles coming in. Still carrying rigidity around the left hand side. Some tension more so on the left hand side. Dyan is left dominant with these sort of seizures. Willow's not exactly helping. Good boy. That's a go. What's happening here? Left foot still, right foot still locking in. Oxygen sets at 96, heart rate 65. I'm kidding. Current time's 5:14. Hey, beautiful. Yeah, I know. So generalized dystonia, so chorea with the leg. So this is the leg movement and thrashing. Chorea is the Greek word meaning to dance, coming from the base of the chore in choreography. I'm still getting dystonia, segmented cranial dystonia of the face or a mandibular, the left hand side. Axial tilt dystonia, causing tilt of the head in an axial location. Focalized dystonia around the left arm. So you can see the feet, you can see the upper body. You're doing okay. You're doing really well. Oxygen starts at 97, heart is 78. Alarms are on, which will indicate to me if certain thresholds which make met call status are reached. Very strong flexation through the left hand. Right hand is supple. Left foot is supple. Right foot is flexed, especially coming through gastrocnemius and back of the hamstring muscle group. But be careful with dystonia coming through diaphragm, intercostals into the larynx, affecting breathing. Eyes are transfixed into left, so we've got ocular situation with the dystonia affecting the eyeballs and giving a fixed glare in a fixed position, so ocular crisis occurring through this action. Oh, kidding. Current time is 5:16. Five milligrams per mil. Midazolam, 5:17. Hey Google, set timer. 10 minutes.
Okay, 10 minutes. Starting now.
Oxygen starts coming down to 93. 92. Beautiful. I'm just going to apply these. Nasal cannula delivering oxygen through an oxygen concentrator. Level 2 output. Tonic-clonic seizure, 5:18, with lip smacking and jaw action. It's all right. Full rigidity of left hand, non-focus on right, no rigidity in left foot, rigidity in right foot, cross-body domain, rigidity of axial tilt affecting the neck through the cervical region. Good girl. I know you're trying very hard to swallow. Very hard to swallow. Oh, Barbie girl. You're not doing a very good position, so I'm just going to overreach you. Just so I've got drainage. That's my girl. There we go. Because of the axial tilt, dystonia in the neck, couldn't actually position the neck, so I'm over rotating her in a recovery position. That's the girl. Good girl. Cough it out. You don't want to aspirate.
This is your Google nurse. Dyan, take your 5:15 PM night medication.
Thank you, Google. That's Google Home Automation in the background, just reminding Dyan with automatic reminders for her medication start for 5:15 should now be commencing. She ain't taking any medications right now. Now that's the time of the day when she should be having one of the medications I've already given her, which is that clonazepam. Hello, beautiful. Stay here with me. The timer is on a countdown for 10 minutes. Focusing on recovery from a result of midazolam. 10-minute window. So we've got bubbling, pursing of the lips, just clearing it up. That's the girl. That's my girl. You're clear on the lips. Oxygen stats are at 99%, under level 2 throughput of the oxygen concentrator. Heart rate is at 75. Midazolam, 5 milligrams per mil, has been applied orally by buccal. That was 3 minutes ago. We've got 7 minutes left on the countdown, typically. 10-minute timer, and Dyan should be free of the tonic-clonic seizures. The dystonia may still continue. They may start to mild out, but we're just monitoring her safety and keeping her okay. Keeping an eye on cardiac, keeping an eye on obviously aspiration and choking. The medications I've given, the clonazepam 2 milligrams, is a muscle relaxant that should help on the dystonia effects that are going through at the moment. Lip pursing, lip sucking. Alright, kid, you're doing so well. This is going to pass. These involuntary muscle spasms will release. I've got an eye on you. So engagement of these muscles around here, the masseter muscles affecting the jawline, grinding bruxism of the teeth. We're going to have to be careful of the enamel structures, the teeth structures, any biting inside with the lips and cheeks. There's still seizure activity going through. So midazolam is still kicking in. Oxygen stats are 98% on level 2 3-put oxygen concentrator. Very strong flexation of those muscles with the focalized dystonia, also known as writer's dystonia or musician's dystonia when it's focalized like that. She'll hopefully relax out with some syncope. 98%, heart rate's just dropping down from 75, 72, 70, 65, 64 going down. Thank you. Room temperature is 23 degrees, that's come up slightly. We've got 4 minutes 48 on the countdown timer. Hello, beautiful. You might be able to see me. Can you see me? Hello, I'm right here. I am right here, my gorgeous. Right here. This is going to pass. You're okay. Heart's doing good. Oxygen's doing good. You've had multiple seizures, tonic-clonic seizures. I've given you some medication. It's going to feel a little bit yucky. Coming out of post-seizure, so this is now in the post-ictal phase, coming out of tonic-clonic seizures. There is that feeling sometimes of yuckiness, the dread component. There's still going to be some dystonia that will affect the eyes and the muscles coming around in the face. Like I said, they're involuntary contractions. They can lock into distorted positions, and they're caused by mixed communications that are coming out of the basal ganglia portion of the brain. And Dyan's got bilateral calcification of the basal ganglia with a movement disorder, also known as Farr's disease. Oxygen stats are good, 98%, under level 2 throughput. Heart rate's at 62. I'm happy on those levels. Keeping an eye on her. Both feet are in-turned, but able to be able to rotate, so no lock coming through the hips. Sometimes a patellar dislocation can occur with patients with 22q. Left and right patella seem okay. We've lost the focalized dystonia. A bit of mild relaxation of the middle finger of the left hand still occurring. Countdown time is 3 minutes 18 on the clock there. That's what we're waiting for. Dyan might be starting to come in coldisms. She may not be able to communicate, but she should be aware, hopefully, that I'm here. Hello, gorgeous. Now, if you're new to the channel, first of all, welcome. Dyan is a person with a genetic chromosomal condition called 22q 11.2 Deletion Syndrome. The point of our channel is to help advocate and educate, create awareness around rare genetic conditions. Dyan's late diagnosed at age 48 with this condition, yet she had every separate sub-condition under the umbrella of 22q over thousands of hospital presentations through her life. She therefore has a microdeletion on the long arm of the 22nd chromosome, missing 30 to 50 genes. That will mean she's missing 3 million DNA building blocks, and that causes anywhere up to 185 clinical symptoms. Of those, Dyan's got quite a few. She has the autism, ADHD, OCD, and the Tourette's. The right side grabbing of the head here is going to be post-seizure pain that actually occurs. This is actually quite a common response. It'll last temporarily, but we're going to give some pain relief. I know, it hurts, kitten. It hurts. I get that. But it's temporarily coming through. Good girl. 0.5 mils of CBD THC, 1010's just been applied already into the buccal region. You're doing really well, kitten. Okay, I'm going to try and help you. 22q is a neurodevelopmental condition at the end of the day. Quite commonly, people who are born with this condition will face GDD, global developmental delays, IDD, intellectual developmental delays. many of the subconditions that Dyan, well, pretty much all the subconditions that Dyan's got. Autism is represented about 30 to 40% of the cohort. ADHD is about 50 to 60% of the cohort. Issues with the palate, either cleft lip, cleft palate, or high palate, which Dyan's got, are about 65% of the cohort. 60% of patients with 22q will have seizure and seizure-like conditions. About 5.1% will have epilepsy directly. Dystonia comes as part of his condition with dysphagia, aphasia, difficulties with talking. Good girl. Skeletal related issues such as scoliosis, CCI, craniocervical instability. Current time is 5:27 p.m. First of the major yawns. That's what I look for. That's my indicator that we're coming out of the seizure component. So Dyan had multiple tonic-clonic seizures. Pardon you. Dyan's had multiple tonic-clonic seizures. The midazolam countdown is on 7, 6, 5, 4, 3, 2, 1. We basically at that point. Hey Google, stop. So that indicates that within 10 minutes of application of an ASM anti-seizure medication that Dyan's responded to it and has been able to come out of the tonic-clonic seizure component. She has multiple different types of seizures: atonic, which is also known as drop seizures; tonic-clonic, rigidity and shaking action, the shake and bake as I call it; myoclonus, which can be like the restless legs and flicking type action; absent seizures, where you can go literally like a reboot offline anywhere between 3 to 10 seconds; focal seizures, both with awareness or awareness, can also occur in this cohort of patients. She is photosensitive to flashing lights, and also highly rhythmical music at a certain cadence can trigger into seizures. Hey, gorgeous. I would say that we've got some electrolyte imbalances going on. We've already known that the potassium level in Dyan's chemistry has been very low. It has led to a heart arrest-related issues only a week ago in hospital. She was ambulanced to her local hospital. We've centralised Dyan's care from 7 separate hospitals across the Perth greater area to 1 major hospital in Perth. Yes, leave it on for me, please. You're 97% under to level 2 throughput oxygen concentrator. You can see we've got the oxygen concentrator just down here running. Levels are sustained, but I want to see them sustained and make sure that we're out of the woods, which we should be. I'll normally look for about 3 or 4 good sustained deep yawns. Part of that's oxygen saturation, trying to bring the oxygen back in from the starvation component. It's also relaxation, saying that her body's relaxing. You can see the amount of butterfly rash across the face. Autoimmune indicators, commonly seen in lupus SLE. Her autoimmune system's not doing too good, that we know already. Hey, beautiful. Your seizures are over. Okay. And what's that? What are you pointing to? What are you trying to do now? Jesus, yes. We do have a new picture of Jesus who's looking directly over you, Jesus and Chub. I'll just show you that briefly. Stunning picture, which is looking over Dyan, keeping her safe and in God's way, which is really important. I know, the pain will release. Can we do some of the Trammel drops, which I was about to give you before? Yep, let's do that. Yep, we'll do 3, okay? Just going to lower you down to do this. I'm going to have a chewy ready to go afterwards, but are you going to be okay to use a chewy? Yeah? Okay. I'm going to set you up to do it once I'm giving you the drops still. Okay, Dyan struggles with the taste of that, so she needs to have a chewy afterwards. My concern, of course, is still if there's dystonia going on, particularly oral mandibular, if it's going to affect swallowing and choking. Not the ideal scenario, which is what we've got happening here right now, as you can see. Yeah, okay. I need to give you the drops, but I may not be able to give you the chewy yet, so we'll wait to see. Okay, Kim. Good girl. 1, 2, 3. Excellent. Coming up for me. Okay, you're going to put the chewy in. Go for it, but if I say spit it out, we're taking it out. Deal? I know, it's not much fun. There might be a little bit of an over-exaggeration on this. No. Dyan, as part of the 22q, is autistic. sensory things really do suck. She also has the Tourette's component, no control on the vocalization, particularly coming around echolalia and then things like coprolalia. So life is interesting when you're not only neurodiverse, but you've got a lot of neurological things coming into play. ADHD, neurodevelopmental, autism, neurodevelopmental, 22q, neurodevelopmental, Tourette's is also in that space of neurodevelopmental. Yeah, a lot of things happening there. Most of these things, well, all of these things are actually out of Dyan's control. So what's happening in the brain, in the messaging, in the signaling, or in the chemistry in her body, which is what we find with patients with 22q, between thyroids, between calcium, a whole lot of those things can have grave implications. Calcium, yes, you have lots of calcium buildups, which is where the calcification bilaterally of the basal ganglia comes in, which affects the messaging. Harry Potter, you're petrified. Yes, it does feel a bit like that, doesn't it? Now, speaking of petrified, we need to also do some checks post-seizure. Toes. Miss, can you wriggle both toes for me, please? Go. Lovely. Bilateral movement is fantastic. In about 10 to 15% of tonic-clonic seizures, Dyan can actually conclude with a paresis or paralysis after the seizure in the postictal phase. It's called Todd's paresis. It can last anywhere from 30 minutes up to sometimes 16 hours. It's normally indicated just in the lower limbs, but it can actually affect the entire limbs and also her arms in some occasions. Total paralysis, can't move until, like an iceberg, it defrosts and things come back. Now, after seizures, we normally have the yawns. That's the relaxation indications that the seizure's over, and obviously we had the countdown timer. The midazolam, in this case, an emergency medication I applied, has helped that. I've also given you some clonazepam 2 milligrams. That was a muscle relaxant. That should hopefully have relaxed things like the dystonia, which I'm seeing from both focal position of legs and hands is good. And we're starting to see that the oromandibular, blathyricism and those components have relaxed. Yes, don't need to tap that. I've got the alarms on over here and I can see what the stats happen to be. Oxygen's at 98%. We're now going to take you off medical oxygen. So we're going to see how you go. God, to be kidding me. That's an emergency alert alarm to get out of the building. You've got to evacuate. Okay. It's okay.
Emergency.
We've got to evacuate.
Emergency.
Fuck me.
Evacuate now.
Stay there. Right, I need to do a couple of things. I'm getting the wheelchair to you. It's okay. It's an emergency evacuation. This is probably a fire.
Emergency. Emergency. Evacuate now.
We're taking the oxygen with us. I'm going to transfer you to this. It's okay.
Emergency. Emergency.
It's okay.
Evacuate now.
It's okay. Not moving yet. Okay. I'll get you, Woody. We've got to get out. Cats are fine.
Emergency.
Far out.
Emergency. Evacuate now.
Good girl, working with me. Working with me. Good girl. Feet peaks. Blanket over you. It's okay, we'll get you out.
Emergency.
Stay there.
Emergency. Evacuate now.
Alright guys, you're coming with us. Alright. Cannot believe the timing of this. Sorry about the rough footage, but we've got to go as is. It's okay, I'm going to get you out. It's okay, cats are fine. I'll take my emergency bag. Wait. Fuck me. Alright. Let's go, people. Let's get the fuck out of here. Alright, things I need. Please. We're leaving the door unlocked. It's okay. Let's go. You come with me?
The stairs. Do you know where they are?
The stairs? Yes. Right, we're going, people.